Next is Mary Rose Sweeney talking about autism and homelessness. So are people with autism overrepresented in homelessness?
Thank you, Anthony. And I'm just getting a signal saying internet unstable here, so hopefully it'll hold up. So this poster was originally presented at the INSAR meeting. It's the International Society for Autism Research meeting, which was hosted virtually last year. It typically rotates between the States and Europe each year, so it was a shame we didn't get to go. The poster describes a prevalence study of autism in homelessness, which was part of a piece of work funded by the NDA in 2019, and there were 3 sub-studies as part of that overall work programme. So I led the prevalence study, and I worked on that with Andrew Boylston and Alistair Churchard from University College London. There was another sub-study, 2 sub-studies in fact, which Breach led. One was a study exploring the lived experiences of people who are experiencing autism and are homeless or have done so in the past, and a study exploring the training and support needs of key workers who provide care and services to people who are homeless and also autistic. So Breach will probably tell you about those at another forum, but just for today we're covering the prevalence study. So the co-investigators were Andrew Boylston, who myself and Anthony have worked a lot with on previous autism research, and Alistair Churchard, he's a clinical psychologist from the University College London. And it was a partnership with, you can see all the logos on the side there, the Dublin Simon Community, the Dublin Regional Homeless Executive, As I Am, who I would say are the leading autism advocacy organisation in the country, and the DCU Ignite team. So Lucy Whist and Sophia were very involved with the project, and their support was invaluable. So like most research projects over the last year and a half, COVID struck bang in the middle of data collection, and this was a complex project anyway without COVID. So you can imagine, the complexities of trying to collect data in the middle of the pandemic. So we basically moved everything online, and we limped to the finish line, thankfully, and got the work done. So basically, the background to this is that adults with autism are at higher risk of poorer outcomes, including social isolation, discrimination, victimization. They have more difficulty attaining and maintaining employment, housing and independent living. And recent research by Churchard, who became one of our co-investigators on the project from 2019, he developed a study to measure autism prevalence in a cohort of long-term homeless people. And this involved a proxy reporting tool, because the population in the London sample were a very hard to reach group. And the team knew that they wouldn't come forward to be part of any multidisciplinary screening assessment, and they were even concerned about ethical issues in approaching people who may never have considered that they had autism before, or may not even have known what it was. So they developed a proxy reporting screening instrument called the DAHI, and you can see that there in the methodology section, which was based on the DSM-5 for the presence of autistic traits. So basically, key workers were trained by Andrew to understand a bit more about autistic characteristics and what they might look like. And they went through a very structured interview, which lasted about an hour with Andrew, each key worker, with their entire caseload of clients, to detail whether or not the following traits were present or absent in any given individual. So these included deficits in social and emotional reciprocity, non-verbal or communication behaviours, deficits in developing, maintaining or understanding relationships, stereotypical and repetitive movements, insistence on sameness, inflexible adherence to routines, highly restricted, fixated interests, hypo or hyperactivity to sensory inputs or unusual interests. So that's basically what they were looking for and what they were screening for. And we worked with the Dublin Simon community, who gave us access to a sample of key workers in an area of Dublin city centre, which would be very typical of a region in their catchment area, and it included all parts of service provision that they would typically cater for. So that included emergency accommodation, supported housing, and treatment and recovery. And so in the end, 106 individuals were screened, and of those, 3 individuals screened present, so 2 males and 1 female, for autistic traits using the DAHI screening questionnaire, which gave a prevalence estimate of 2.8%. And a further 7 clients, which were 6 males and 1 female, screened possibly present for autistic traits. So when we combine these 2 estimates, we get a combined estimate of 9.4%. And I didn't mention over here that our prevalence estimate for the general population is around 1 to 1.5%. So you can see that that's quite higher in this population. So the study then reports a higher prevalence estimate than previous Irish studies in the general population, but a lower estimate than the UK study. But we're confident that differences in the sample will explain this, because the UK sample was a much more entrenched or long-term, homeless population who, if they lived in the States, would be classified as street homeless. And we couldn't find a sample like that in Ireland that was big enough, because it's a very small group of people in Ireland who are living in street homelessness. So we weren't able to have a direct comparator group. So the study supports the emerging evidence then that people with autism are overrepresented in the homeless population compared to the house population. Autism may be a risk factor then for entry into homelessness, and is possibly an added challenge as well to exiting from homelessness. And if anybody's interested in seeing the full report, it's on the NDA website and available at this URL here, which I'm clicking, but it's not opening. So, but anyway, if anybody's interested, I can certainly share it with you. So that's it. Thank you very much for listening.